Cherokee Mental Health Center was the original name of the organization, and we began as a mental health center. We found in working with patients that some of our areas were really short on primary care, and we also realized that in primary care there's a lot of behavioral health. So in order to improve overall care in our community, we branched into primary care in 1984.
I think you're definitely a team player, people who are good communicators, people who are high energy, because primary care is high energy and fast paced, and flexible, because I interrupt Amanda multiple times, she'll interrupt me, and that's a good thing, to be able to be flexible, because I'd rather handle something right then and there than wait until later.
Well, I think that you can be more comprehensive, you have resources around you, and you're more likely, with a physician that has immediate access to someone, you're more likely to go into more depth and investigate that and to come up with a treatment plan on the same day instead of leaving an unanswered question, right. To try to think of it after a busy day, what have I not addressed today? So I think having the resources around you, having the team in place that can work with these issues together on the spot, and not having to bring the patients back 2 weeks from now, 3 weeks from now.
We found that the best model is really nesting a behaviorist in the primary care team. So we have embedded behaviorists in the primary care team. These behaviorists function with a schedule that's very much like a primary care provider. It really mimics that pace. They are available real time to deal with problems that come up in the primary care environment.
The other thing I like that's very nice about having a behavioral health provider is once the behavioral health provider has seen that patient, after I've been in, we touch base again. Exactly. And many times we walk into the exam room together and discuss it as this is the treatment plan that we've agreed upon. And that feels good. I think that you don't have two providers saying different things to the same parents and to the child.
Yeah, I would say flexibility would be key, because so often people get in their own routine of doing things in a certain way with certain papers and certain forms. But if you're able, to be flexible and learn a new system like an EHR, I think that's been really challenging.
And it really validates what we're trying to go for. So when we're literally standing side by side talking about this particular issue, and then empowering the family to be a part of that team, you really can't get a better experience than that, because it validates both pieces of that.
So much of primary care is really behavioral. I've never talked to a primary care provider who didn't tell me probably half of what they do pertains to the mental health of their patients. So primary care providers are never surprised, when we talk about how much behavioral health is really present in that environment.
It's shared patients, which is really different than most models. It's not the case whether it's your patient or my patient. We're doing this together. So almost every issue is clearly understood has family, emotional, social issues combined with the physical piece. And so it allows us to better meet those needs in one particular setting. We're not part and parceling that out. We're able to deal with that together.
But virtually everyone comes to primary care, and so if the behaviorist is blended within the primary care team, it's a perfect way, I think, to bridge that gap.
I like that we speak the same language also, because it really reiterates what I say. If I can quickly communicate what I want the behaviorist to help me out with, and they say the same thing to the parents. We're concerned about the development of diabetes and hypertension and things like this. And these updates that, whether I see the patient or the behavioral health provider in the future, we can constantly keep one another up to date.
So just to help out the primary care provider by bringing in someone who is trained in behavioral sciences adds a whole lot to the primary care treatment.
It's definitely made me personally as a provider more efficient in helping with patients with complicated mental health issues. We see a lot of people with complicated medical issues that also have complicated mental health.
And so it takes some creativity sometimes to bring these two sectors together and make sure that you've got a funding stream that's going to sustain the model.
No, I couldn't see practicing any different.